Although consistent PFMT routines are key elements in the recovery of muscle functions in mild to moderate urinary incontinence, these routines are not always easy to follow. Some women face problems related to exercising correctly, boredom, or keeping up a daily routine of exercise in the absence of immediate noticeable results. All of these can contribute to decreased self-efficacy, which is confidence in the ability to carry on with exercises for as long as necessary. Low self-efficacy has in turn negative impact on adherence. A key aspect is to find an appropriate blend of strategies that would keep women motivated to perform PFMT. It is known that access to our performance and progress is a strong motivator to continue. We are also more likely to encourage routines that are enjoyable and more likely to stick to exercising routines as long as we have a clear plan as to when and where we will perform the respective activities. So we try to optimally blend these elements of success into one easy-to-use app with games by paying attention to the wishes and needs of women with urinary incontinence. The games, besides being enjoyable, converted women's experience in a visually intuitive and comprehensive way. Further, patients could schedule their next training sessions into the calendar, contact their therapist in case of difficulties, access their future exercise plans, and track their past performances. What would have otherwise been a boring routine became a challenging and fun activity. The key to a good system that keeps users engaged is a result of finding ways to give voice to their needs and find solutions for their barriers. This is why taking into account the psychological processes involved in following medical recommendations is cornerstone to encouraging patients to take over the responsibility of training routines.
Päätin lähteä mukaan tutkimukseen, koska virtsankarkailuni oli synnytysten ja ylipainon kertymisen myötä pahentunut. Nyt 3 kuukauden harjoittelun jälkeen virtsankarkailuni on vähentynyt. Voin yskiä ja aivastaa housujen kastumatta. Harjoittelu kylheisillä peleillä oli hauskaa, vaikkakin se vaati viitseliäisyyttä. Oma edistyminen motivoi pelaamaan ja lantionpohjan lihasten kunnon ylläpitämiseksi olisin valmis jatkamaan pelaamista.
Women Up device has given me a new kind of approach to the pelvic floor physiotherapy. I can easily make individual training program and I can be sure that the right amount of contraction and relaxation will be done. I can change the program even without appointment visits, and that's very useful, especially if the patient lives further from the hospital. I think that the games can motivate women to practice more regularly. That is the key point of training effectiveness.
The Women Up project show us the advantages of the eHealth in the field of urogynecology. With this project, we have discovered an innovative tool to improve adherence to treatment, access to treatment, and also treatment supervision. In fact, these are 3 key points for the success of any conservative treatment, including, of course, the conservative treatment of pelvic floor disorders. First of all, with this system, I can automatically check the adherence of the treatment of my patients. And the most important thing is that they know it. And if you know that someone is supervising you, the adherence increases. For instance, we can ask to the patient the reasons for the possible training break, for instance, or you can encourage with some messages also the patient for their daily practice. In addition, the system provides us some graphics at the end of each session showing the electromyographical signal of the pelvic floor muscles and also the abdominal muscles. So we can control if our patients are performing correctly the exercises or not. And depending on the results of these graphics, we can decide if we want to increase or decrease the level of difficulty of the program. So the treatment is very personalized. And finally, the possibility to perform the exercises at home or wherever you want or whenever you want is a great advantage for the access to this supervised treatment, especially in people who live far away from the hospital or with less flexibility in their jobs.